Hello, welcome everybody. I'm Dr. Mona Meyer and I'm here from the Arcadia clinic in Germany. And it's really my pleasure that I'm sitting here with Dr. Henning Saupe. He's director of the clinic for many, many years already, and it's just wonderful how he runs his clinic. And I really would love to introduce him to you and that you learn about the clinic and what we are doing here and what this is about. So Henning, this is such a pleasure to sit with you here and ask you. So tell us about the clinic. What is the clinic about?
Thank you, Mona. It's a pleasure to be on video together with you today. Well, Arcadia Clinic in Germany, what it is about. I founded Arcadia Clinic in Germany more than 16 years ago in the city of Kassel. And for the first 5 years, we run a city clinic in the middle of the city of Kassel and wanted to expand our work with international patients and have our own restaurant and more guest rooms. So we found this beautiful location in a curative village called Bad Emstal, 20 kilometers outside of the city of Kassel, right in the middle of Germany, in the German woods.
Beautiful green landscape.
You see the green park behind us. And we had the opening of this clinic 8 years ago. So a few weeks ago, we celebrated our 8th anniversary. And ever since we opened our doors at the new Arcadia Clinic in Bad Emstal, we welcomed guests from more than 50 different countries. We have 10 bedrooms and a staff of about 20 co-workers who join me in this fantastic work here at Arcadia. And what we treat is patients with chronic illnesses and especially illnesses that belong to the large group of cancerous diseases. In fact, most of our patients suffer from cancer and call us when they really need to expand their toolbox to get their disease under control or to turn it around. Some patients call us in an early stage, but the majority of patients who call us are heavily pre-treated and have been in various treatment plans, normally in regular hospitals, oncology clinics for many years, and call us when their life becomes more difficult and they need a new way to treat their condition.
So how does this new way look like? Like what are they finding here?
Well, I would say the most important difference between our approach, the Arcadia way to health and healing, and the traditional evidence-based mainstream approach in Western world clinics is that we do not only focus on the symptoms of the disease, but we look at the entire organism around. We look at the individuality, the person who suffers from the disease, and not only on the cells that represent the disease. So we call the traditional approach the tumor-focused approach. And that is what you get in a regular hospital, in a regular oncology ward, where the entire treatment is focused on the disease, on the cells, to either cut them out or burn them with X-rays or poison them with toxic chemotherapy or block it with a hormonal blocker. What we do on top of this tumor-focused approach is we look at the entire terrain, which is literally the whole person around the disease. If you have a spot somewhere in a human organism representing a cancerous disease, you should not forget that there is an entire organism around it that either supports the growth of this disease or does the opposite, holds it under control, holds it at bay, or defeats the health with the immune system. And this part of the treatment is called the terrain aspect, the terrain approach, the terrain focused approach, which is about all the health factors that naturopathic doctors care about, which is nutrition, immune system, detoxification, the flow of energy in the human organism, the quality of sleep, the quality of the thoughts and emotions that the patient lives with, knowing that uplifting and healthy thoughts make our immune system stronger, and worries and thoughts of desperation and fear do the opposite. They they break down our immune system and block the natural self-defense against cancer. This part of the academic world is called neuroimmunology or psychoneuroimmunology, and since 20 years back in time, we got so much scientific evidence that our emotions, our mindset matter. So this is another aspect of what we call holistic approach, from the Greek word holos, which means the whole thing, not only the tumor, but the whole thing.
Yeah. So when a patient or client comes here, how does the treatment plan for them look like, or a stay for them?
Yeah, very good question. So we ask our patients, all the ones who apply or send us emails, to send us as much information as they can get hold of. The entire documentation, all the blood tests of the previous years, all the treatment protocols that they went through, and most importantly, the most recent diagnostics, the CT scans, MRI, PET scan, whatever they have, and the tumor markers and blood values. And based on this documentation, we make a primary assessment whether or not we can be of any help in this particular situation.
Okay. So you basically have a consultation call?
Yes, first thing is patient contacts us, and then the patient gets a questionnaire and is invited for a free of charge first getting to know each other meeting on Skype or Zoom. 20 minutes is what we offer applying patients to find out if we want to co-work with each other, if we want to work together. And if we see, based on the documents that we have looked through and based on the interview that we do and the questionnaire, that our clinic could be the right choice for the patient, we say yes, you are welcome to come to our clinic for treatments, and then the patient receives an email with a treatment proposal and a treatment plan. And if the patient agrees to it, we welcome the patient to fly into Frankfurt Airport if it's an international patient, and from there we take care of everything. And we send our taxi shuttle to Frankfurt Airport and bring the patient door to door with our own taxi service. And from the day the patient has arrived here, we host the patient as a hotel guest and a treatment patient at the clinic. So first meeting with the patient takes approximately an hour and a half, and that is where we find out what is the best treatment for this particular patient. And a standard of our clinic is to do a proper assessment for all the needs the patient has, and we send blood tests to various laboratories, we send stool samples to laboratories to check the microbiome, we do toxicity tests, and in many cases we also send blood or even biopsy material to a laboratory in our vicinity that is the European leading laboratory for oncologic diagnostics, and we do a so-called chemosensitivity analysis based on either tumor cells in the peripheral blood or a biopsy if a biopsy is available. And the laboratory checks out which drugs has the highest likelihood to block the tumor and or look from the other side around what the tumor cells are sensitive for. Do they die from artesunate or Chinese wormwood or vitamin C or green tea extract or turmeric or sugar oil from ginger or mistletoe extract, or do we need to go into low-dose chemotherapy, something we offer some patients who have more aggressive kind of tumors, where we apply insulin potentiation, low-dose chemotherapy, something our listeners can check out on our website. It's a technique that modulates the blood sugar with a little bit of insulin and makes cancer cells much more sensitive to the treatment when blood sugar is low. Yeah.
So when the clients come here or patients come here, and do they need to wait for all the results and then the treatment starts, or do they get?
We start immediately with the best treatment based on our experienced knowledge from the many years we've treated patients, and from day to day we get more laboratory results and fine-tune and adjust treatment after some days based on the laboratory results.
And how long is the stay? Like, how long do they?
In average, patients who travel to Germany and do not live next door, we recommend a stay of 3 weeks. Some patients prolong their stay and stay 4 weeks. In exceptional cases, we have had patients here for 2 months. It is also possible to come for a couple of weeks. Less than a couple of weeks is not really what we recommend if the situation is metastasized cancer, which is 90% of our patients that face a situation with metastasized cancer. Maybe in a situation where the treatment is preventative, secondary prevention, like after a successful surgery with no evidence of disease, some patients can come for a 2-week stay, but in average, patients stay for 3 weeks.
And Henning, what about there was one more question I wanted to ask, like, how do you measure whether a patient had actually progress or like a better, like, like how...
How do we evaluate the treatments?
How do you evaluate that it works?
We evaluate the success and the outcome of our treatment exactly in the same way as our colleagues in mainstream hospitals. We use blood tests, we use tumor markers that we measure in patients' blood. We send our patients to radiologists or ask the patient to evaluate the treatment after approximately 4 weeks. When they travel back home, they need to wait in average for 4 weeks in order to be able to measure how they have reacted to the treatments. Because although if cancer cells die already during the treatment, they're still there, and the immune system needs in average a month to clean up the dead cells. So before you see a shrinkage in an X-ray picture or CT scan or PET scan, you need to wait approximately a month. That is also the standard in regular oncology, that there is no difference in how we evaluate it. We use ultrasound, we use infrared-based imaging, especially for breast cancer. But we also use the standards in oncology, like CT scan, PET, or MRI, and markers. If markers are available, not every cancerous disease has a reliable marker.
Oh, that sounds really, really fantastic. Is there anything that you would recommend people to do who live with cancer, who are just diagnosed?
Well, I just published my book a few months ago in Germany, and I'm excited to see the release of the English edition on November the 1st. And in this book, I expressed my knowledge and what my experience from the last 25 years. The title of my book is Holistic Cancer Medicine. Holistic Cancer Medicine. You can already pre-order it on Amazon or go to the publisher's website, Chelsea Green in the United States. Chelsea Green is the name of the publisher. So Chelsea Green has it on their website for November the 1st, and Amazon has announced it to deliver it from November the 15th. And that is, of course, my first recommendation if somebody lives with cancer. The second recommendation, equally important, is don't wait too long until you take action. Contact us as early as possible, not only when the last standard treatment has lost its potential. Call us early and the chances are bigger to help you.
Yes. Thank you so much. I hope this gave you some more insight and information about what is possible when you have cancer, because there's so much you can do. And wherever you are, we wish you much health and healing. And we are here. Contact us, reach out to us, because you are never alone. Bye for today.
Thank you, Mona.